Hello and welcome to Lyra Nara. In this video I'm going to present to you an amazing holistic health device that is also extremely versatile, easy to operate and quick acting, called the Kindling Easy. And we're going to discuss all of its features, what it can do for you. We're going to show real patient cases and how we're going to teach you how to interpret the results. It's very intuitive, as you will see, very easy to operate, very quick acting, and it allows you also for the creation of customized homeopathic remedies and for an adaptation of your therapy to the patient's particular needs. And the best news about the Kindling Easy is that for a limited time only you can get it at an amazing discounted price at lyranara.com. Link in the description box below, so take advantage. But before I tell you everything you need to know about the Kindling Easy and what it can do for you, if you enjoy this type of presentations where we talk about holistic health solutions, please support our work by liking, sharing and subscribing, and also do not forget to hit the notifications button, the little bell icon, so you don't miss out on the weekly content that appears here. Without further ado then, let's learn more about the amazing Kindling Easy device. So what is the Kindling Easy? It's a systemic functional therapy and diagnosis device. Unfortunately, we often start to think about our health when it's already too late, when we have already accumulated a whole load of chronic diseases, so we are in a morbid state. That is, that we suffer from chronic autonomic dysregulation and we have acidic diseases, etc., etc. And in this case, only a systemic autoregulative therapy can help. And the best systemic functional therapy device that we know of is the Kindling Easy. It's a unique and amazing solution that can help you with cardiovascular diseases, with gout, rheumatic diseases, psychological diseases, osteoporosis. It brings about also secondary prophylaxis with stroke, great for addressing Candida albicans, allergies and intolerances, recurrent bladder inflammations, type 2 diabetes, renal overloads, and so much more, as you will see. But first we need to understand how it's all possible. And for that we need to understand the autonomous nervous system and how it functions. The layman should distance himself from the one-dimensional thinking that a chronic disease simply erupts in the body and the defense mechanisms then kick into action. Chronic systemic conditions and their development history is made up of many layers of maldevelopments. The beginning often remains unnoticed somewhere in the past. And as long as we do not know the disease history for a specific patient and we did not process and resolve the impact of that biological stress event, we cannot give a correct treatment. Even the goal of eventually conquering the illness by immunological means remains vague for as long as the symptoms history and causes are not understood. And in this graph you can see how chronic diseases normally develop. We have epigenetic factors, we have environmental factors and other triggers such as psycho-emotional shocking events that affect our limbic system, and it can also be seen in a brain edema. So we have stress factors, and these stress factors cause a melatonin depletion, a tryptophan depletion and an adrenaline depletion. Also energy blockages and symptoms such as sleeplessness and tiredness. And this stress affects very quickly, within days, our autonomous nervous system. And then in turn this affects our hormonal system. We see the adrenaline depletion and a Krebs cycle dysregulation. We also see a niacin NAD depletion and a vitamin C depletion. And if we do not put action into place right now, we will go into chronic morbidic states and we will develop systemic conditions. Our cells will depolarize, we will go into fermentation mode, we will have tissue acidity and other symptoms related to that. And when we can repolarize the cells, when we can rebalance our autonomous nervous system, then we can heal ourselves. And the autonomous nervous system is really crucial for our self-healing powers. It is the system that contains the most motoric neurons and supplies all the glands, the smooth muscles of the inner organs, and the heart. It is called the autonomic nervous system because it works without the centers of the cerebral cortex, and thus it functions without a conscious mind control. It works with the hormonal system, and it is controlled by the hypothalamus and the brainstem, especially by the medulla oblongata and the brainstem pons. And the ANS is responsible for all vital functions: blood circulation, heartbeat, breathing, body temperature regulation, blood pressure regulation. It also controls the gastric juice secretion and much, much more. And it consists of two parts that work together antagonistically: the sympathetic nerve and the parasympathetic nerve, or the vagus. All sympathetic fibers pass the sympathetic trunk, which is a ganglionic chain on the left and on the right of the spinal cord. The parasympathetic path crosses the 3rd, 7th, 9th, and 10th cranial nerve, so the vagus, and some nerves emerging at the sacrum. And the vagus leads to all organs in the thorax and the abdomen. All vital inner organs are always regulated by two motor nerves, S and P, which act antagonistically, one activating and one sedating the functional activity. It is, if you want to imagine it, like the yin and the yang of autoregulation. And in this table you can see how this works. So in red we have the function of the sympathetic nervous system, and in blue the parasympathetic antagonistic part of the ANS. And you see, for example, that for the eyes, the sympathetic reaction is a core diastasis, a contraction of the ciliary muscle for close vision. And then we have the antagonistic part, the parasympathetic part, which brings about a contraction of the pupil. And then it goes on for the same principle for the lacrimal glands, salivary glands, the heart, the lungs, the digestive tract, the liver and the gallbladder, the adrenal medulla, the kidneys, the bladder, the genital tract, the respiratory tract, the blood vessels, and the skeletal muscle vessels. And you can see it always works like a yin and yang. One activates and one sedates. And this needs to be, of course, in perfect balance in order for us to remain healthy. And this graph shows you also very nicely how this antagonistic relationship works for different organs. On the left, a sympathetic action, and on the right, a parasympathetic action. For example, for the rectum, a contraction of the rectum by the sympathetic and a relaxation of the rectum by the parasympathetic. The same, for example, for the bladder, we have an inhibition of urination by the sympathetic and an activation of urination by the parasympathetic, etc., etc. The question then is, how can we measure the activity of the sympathetic response and the parasympathetic response of the ANS? Well, we have the tissue's resistance, a so-called R value, that is significant for the parasympathetic nerve activity. And then we have a C value, which is the tissue's capacity, which is significant for the sympathetic nerve activity. And healthy individuals show the following normal range of R and C values: an R value of 8 to 15 kiloohms, a C value of 0.15 to 0.25 microfaraday, where in the S dominance range is 1.5 to 8 kiloohms and 0 to 5 to 0.5 microfaraday. A P dominance range is 15 to 150 kiloohms and 0.03 to 0.15 microfaraday. There are no gender differences, and children are more S dominated with a value of 6 kiloohms and 0 to 7 microfaraday. Elderly people are mostly P dominated with R values higher than normal. The measured values can give insights about a therapy to be applied. And the normal P and S range does not mean, however, that a patient is healthy. It means only that a patient is balanced properly and treated correctly, and the body is doing its autoregulation work correctly. And P and S activity is influenced by the following data: mineral balance and trace elements within the body, acidosis and alkalosis, so the pH ratios, redox system, temperature and pulse, chronobiology, as outlined by Dr. Hoff already 70 years ago, and the nerve conduction system and glands. An S irritation is accompanied by the following typical symptoms: glycogenolysis in the liver, thyroid excessive secretion stimulation of the thyroid, and an increase of blood circulation in the muscles, or a tremor known as core diastasis. A P paralysis is accompanied by the following typical symptoms, which are a decrease in salivation, atonia of the gallbladder, and inhibition of bile secretion. And here in this little table at the bottom right, you can see diseases that are related to a dominance of the sympathetic nervous system, so a high C and a low R value, for example colitis, psoriasis, ovarian cancer, hypernephroma, malignant melanoma, and seminoma. And then you have the diseases with a dominance of the sympathetic nervous system, so a high R and a low C value. For example, focal toxicosis, enteritis, cholangitis, cholecystopathia, state after hepatitis, sclerosis, intoxication, lung carcinomas, mama carcinoma, and all types of carcinomas in a terminal stage. How does the Kindling Easy work then? Well, it's a fully automated system with self-calibration, and it allows you for dynamic treatment and measurement of the ANS activity that we've discussed. That gives you so much insight into your health state. It offers thereby 100% customizable therapy to the patient's need, and it works with recurrent self-calibration every 2 minutes, and measurements for it has a total 7 therapy loops per session, so only 16 minutes of therapy time. As you can see, the measurement takes only 5 seconds, and each therapy loop takes about 2 minutes, so it's extremely quick. The measurement technique is really simple. It's hand-to-hand skin conductivity measurement, and it's easy to afford to use privately, or you can also delegate the work to less qualified personnel in your practice, such as your nurse. It's dynamic, it's fully automated, and it allows you for error-free therapy parameter selection based on the most recent self-calibration and measurement, and complex autoregulative bioresonance procedures based on autonomic nervous system responses. It's very intuitive to operate, and you need no computer. Everything is integrated. It has, as you can see, a color display which allows for a graphic representation of the treatment changes also. And it gives you an immediate and comprehensible display of the treatment results and brings thereby a very high acceptance for the patients. And it allows you for efficient work, no wasting time. It's cost effective for doctors as well as patients. And you can see, apart from taking the measurements by through the electrodes, so from the hand-to-hand skin conductivity measurement, you can also take measurements by inputting samples of body fluids such as blood or urine. And of course, you have an output beaker where you can also create your own custom homeopathic remedies. Let's explain this in a little bit more detail. So you have channel 1, which brings you the endogenous frequency patterns. So those are collected through hand-to-hand measurements using two brass gold-plated electrodes. The sweat production is modulated, of course, by the autonomic nervous system, as we have seen, and the ANS is correlated with the body's regulatory capacity. And why do we take the measurement through the hands? Because the palms of the hands have a very high density of sweat glands, about 400 sweat glands per square centimeter. The sympathetic nervous system increases sweat gland secretion, and the parasympathetic nervous system reduces sweat gland secretion. Then we have also the second channel to take measurements and to perform therapy. And this channel is for the exogenous frequency patterns, and those are collected from body fluids such as blood, urine, and saliva. And here we can see the graphic representation of the results that the device gives you. We have a very simple scale. We have an energetic response scale and an ANS response scale. You can see it goes from 10 to infinite. In a 40s range, it's a normal energetic range. And if you go towards infinity, it means that we have a strong energetic overexcitation. If we go towards the 10 value, it means that we have an energetic deficit. Also translatable into a parasympathetic situation if it goes towards the value 10, which is indicated in blue on the display, and a dominant sympathetic tone if it goes towards the red line in the graph, the infinite value. So the results are very simple to interpret and are displayed in a very comprehensible, easy to understand manner. Next, let's go through some results of real measurements from patients and see how you can interpret and use this data. On the top left, you see a graph pretty much hovering around a 40 value, so around the green line, which means that a patient is energetically balanced, has a normal but a little bit sluggish autoregulation. The second graph shows you an energetically balanced normoton patient with strong autoregulation, and this is because the graph reacts to the different inputs here. As you can see, it doesn't stay that flat. Then in the third example, we have an energetic low with slight parasympathetic autoregulation and an energy increase. In the fourth example, we see an energetically balanced patient with very good autoregulation based on a good ANS response. And this is actually, if you see a curve like that, this is the best autoregulative curve possible. In the fifth example, we see an energetically balanced patient with favorable autoregulation with a tendency toward a parasympathetic dominance with an energy drop. And in the sixth example, we see a patient with energy low with parasympathetic autoregulation with a jump towards higher energy at the end of the therapy, and this is known as ignition. Some more examples of how these graphs can look like and what they mean. The seventh example here on the top left shows a soft autoregulation with a slight tendency to a stress accumulation. It's sympathetic driven and specific for diseased conditions. In example number 8, we see a parasympathetic driven soft autoregulation with a strong jump into energy normalization and ANS balance. The ninth example shows an energetically exhausted patient with a parasympathetic moderate autoregulation. We also see a drop in energy level to eliminate stress. This is often characteristic for the healing phase. Example number 10 shows a parasympathetic dominant start with a strong ignition of normotony. Example number 11, the same situation as in case number 10, but much stronger effect and jump at the end. And number 12 shows a typical autoregulation rigidity, meaning that a patient is very sick and there is no indication of a healing effect regulation. So we need, if we see a graph like that, we know that we need to adjust our therapy. Now let's go through some real life cases, see the results and what they mean. First up is a case of a 72-year-old male patient who complains about heartache and where the doctors recommended to this patient that he undergoes a heart surgery. This patient was treated with a heart-specific preparation of highly concentrated G-strophantine, 3 milligrams. And if we look at the curve, we see that the medication in this case shows a reactive behavior. After 90 minutes, the last measured final value is already 20 points lower, meaning that this patient reacts very, very well to the administration of G-strophantine in this case. And indeed, this patient lost his local heart and chest pain and the surgery was cancelled. Next example we have here is that of a 68-year-old male patient suffering from colon cancer that is metastasizing with an initial R value of 84 kiloohms, as we can see in the graph. This patient was treated with Spengler-Sam Colidoron, which is an intraesophageal liver preparation, 25 drops in this case. And if we look at the curve, we see a clear decrease with a synchronal C for a sympathetic value decrease. And after 60 minutes, both R for the parasympathetic and C values for the sympathetic increase again. Within 90 minutes, we see an improvement of the values with output of R, so the parasympathetic at 36 kiloohm, which is in the normal healthy range. And as you can see already from the good response of this patient, we have a good outlook for him, and indeed this patient survived this cancer for years without chemo or surgery. Next patient case is an 82-year-old male suffering from multiple disorders, a cardiac insufficiency after emergency operation of a perforated colonic diverticulum, and also senilities. If we look at the graph, we see an R value for the parasympathetic at the beginning of the therapy of 78 kiloohms. This patient was treated with white organ 80, 68, 70 and 71 for neural therapy. And if we look at the curve shows a clear decrease of the R value for the parasympathetic from 78 to 42 kiloohms. And the C value for the sympathetic, it reacts very little, meaning that the therapy in this case is well tolerated. The R value after 90 minutes went down to 38 kiloohms, meaning that the therapy was very successful and the health state and well-being improved significantly. So, as you can see from all these examples, we can monitor our therapy results in almost real time and see whether we have chosen the right one for this particular patient. Next case is that of an 83-year-old female who is polyrheumatic, suffers from arthrosis as well as circulatory disorders and diabetes. This woman was treated with white organ Revit organ 43, and if we look at the curve shows a clear increase of the R values, so the parasympathetic value, then a decrease, and finally heightened values within 90 minutes. The therapy was very successful, the pain of this patient diminished significantly and the cardiovascular system stabilized. Here we see the graph of a 66-year-old female suffering from mammocarcinoma that is metastasizing. This woman was treated with galvanic therapy as well as the homeopathic immunotherapeutic Vitorgan preparations. And if we look at the curve, it shows several stronger reactions of the ANS, and thereafter the health condition is stabilized significantly, meaning that the patient experiences significant well-being after the treatment, and the change in the curve shows a tendency of normalization. For this patient, the therapy was very successful, and for years the patient was free of relapses and metastases. Here we see the graph of a 45-year-old female suffering from mama carcinoma with multi-sided metastases, extreme malignancy, also determined by a histological examination. This patient was treated with Vitogan combinations called arthro-chelan as well as galvanic therapy, and this was administered separately on different days. If we look at the curve for the sympathetic C values does not react anymore, meaning an ANS autoregulation stasis. The stress is overwhelming, and we see in the patient also an adrenaline depletion, and the prognosis therefore is bad. And indeed, unfortunately, in this case, the results were correct because the patient died shortly thereafter. Next, we have a 45-year-old male suffering from seminoma, so a sympathicon state, as well as secondary esophagus carcinoma. This patient was treated with Vitogan combination, arthro-chelan, as well as galvanic therapy, administered again separately on different days. If we look at the curve peaks from a single administration of the medication. And this means that the patient responds well to this kind of treatment, and the result indeed for this patient was that he significantly prolonged his life. Another pattern can be seen here with a 70-year-old male patient who suffers from metastasizing hypernephroma and sympathicon cancer shown in the original curve. This patient was treated with additive non-toxic therapy, 42 vivid artemisinin sessions, as well as galvanic therapy. And when we look closer at the curves, we see that the curve peaks at a parasympathetic R value of 64 kiloohms with an antagonistic behavior in the sympathetic C curve, which means this patient shows a positive reaction of the immune system. And indeed, the patient prolonged his life for 15 years with a good quality of life as well. And the last example I'm going to show you in this presentation is that of an 88-year-old male patient. Here's the long-term curve spanning over 3 years. This patient suffers from bronchopneumonia and COPD. Was treated in this case with Spengler SAM-G every second day, twice 15 drops per day, as well as the vivid artemisinin therapy in 42 doses and galvanic therapy. And if we look at the graph, we see after a while remarkably heightened R values for the parasympathetic, and thereafter step by step of normalization. And this gives us a good prognosis for the patient and means that the therapy works really well in this case. By the way, if you ever need help with the interpretation of these results, we are here at Lyra Nara. When you purchase the Kindling Easy from us, not only do you get it for a limited time only at an amazing price, but we are always here to help you. You can always call us if you cannot interpret the results, even though the device comes with a very comprehensive booklet with many examples, just as some of the ones I have showed you, so that you get a deep understanding of how it works. As I said, it's fully automatic, it works really fast, it's therefore cost effective for you and your patients, is non-invasive, and as you can see from all of the cases I've shown you, the results are not that difficult to interpret. You can also create, of course, your custom remedies with the devices mentioned. So it's extremely versatile, highly recommended. Link in the description box below. Of course, if you have any questions about a Kindling Easy or any of the subjects discussed in this presentation, do not hesitate to contact us. 1-888-773-3196. That is 1-888-773-3196. I'm also going to post, of course, the complete contact information in the description box below for your convenience. If you've enjoyed this presentation, please also do not forget to support our work by liking, sharing and subscribing. Also hit the little bell icon, the notifications button, so you don't miss out on the weekly holistic health content that appears on this channel. And with all that being said, stay healthy. Until next time.